Hello, my name is Jibrin Kama. I work for the Clinton Health Access Initiative in Nigeria. I lead the Laboratory Access Program. The title of the poster presentation today is Use of Facility-Based Provider-Initiated Testing and Counseling Approach to Ascertain Viral Hepatitis C Status in High-Burden Populations in Nigeria. So just for context, Nigeria has an estimated burden of about 24 million people living with hepatitis, 4 million with hepatitis C, and about 20 million with hepatitis B. In terms of national prevalence, we have about 2.2% of people with hepatitis C, which translates to about 3.6 million people. So what we try to do with this is that we understand in the country, a lot of people are not aware of their status. So we try to adopt what we call the provider-initiated testing and counseling that's being used for HIV, to adopt that for hepatitis, to see how we can find more patients so at least they'll know the status, whether or not they have hepatitis. So what we did was basically in a state in north-central Nigeria called Nasarawa, it actually has a prevalence of about 13% for hepatitis C. But the fact that we know that a lot of people still don't know their status, we said if we can implement provider-initiated testing and counseling, we can get more people aware because they can come into the health facility, get tested, and know whether or not they're seropositive. So I'm going to take us through exactly how the model works. So the idea is patients come into the health facility, they see a doctor. The doctor refers them to the lab to get tested, to get screened. If their results are actually sent back to the doctor. If the result is actually negative, they're sent for preventive services. If they're confirmed to be seropositive, the patient is actually sent to a gene expert testing lab. So at the testing lab, the medical lab scientist collects the patient's sample. The results are sent back to the doctor. If the patient is positive, they're actually put on drugs. So if the patient is actually non-cirrhotic, they're placed on treatment for about 12 weeks. But if they're cirrhotic, they're actually placed on treatment for 24 weeks. So this is basically the way Cascade works. For every patient that comes into the facility from outpatient care, they're recommended to go for screening. Once they're screened, if they're positive, they're actually sent for confirmatory testing at the testing lab. Once they're confirmed to be positive, they are placed on treatment based on their cirrhotic status. So we did this in about 2 facilities in Nasarawa State, one being a tertiary institution, the other being a secondary institution. So in terms of our results, what we actually saw was that with PITC, we are able to increase the number of people that are actually being screened. For the facility in DASH, which is the tertiary institution, we actually saw a 31% increase in the number of people actually getting screened. For the facility at GH Akwanga, which is the secondary facility, we saw a 103% increase, a larger increase in the number of people that are actually getting access to screening to know whether or not they actually have the hepatitis C virus. So we saw a larger increase in the number of facilities, number of patients at that facility. Lastly, in respect to the cascade, so basically people have to sort of run through the cascade, getting screened, getting confirmatory testing, and then if they're positive, being placed on treatment. So based on the fact that CHA had actually done a lot of work around market shaping, we're bringing down the cost of the screening tests, bringing down the cost of the confirmatory tests, bringing down the cost of the drugs, we're able to get a lot more people to go through the cascade. So this just shows you a general overview of what we're able to achieve. At the tertiary institution, we're able to screen over 1,000 people. Of those 1,000, 326 of them were confirmed to be HCV seropositive. Of those, 221 of them were confirmed to actually have the virus. And we're able to place over 112 of them on treatment. For the other facility, which is GH Akwanga, for the 790 people that were screened, 122 of them are confirmed to be HCV seropositive. 70 of them got HCV viral load testing. 44 were confirmed to be HCV viremic, and about 60 or so of them were placed on treatment. So the whole idea is to show that using provider-initiated testing and counseling, you can get a lot more people through the cascade who can confirm their status, whether or not they're hepatitis C positive, and then take them through the cascade to ensure that they get the treatment that they need.